In this episode of the Courageous Public Health Podcast, Angela Bannerman Ankoma shares what it looks like to lead unapologetically and act despite fear in public health leadership, especially in moments of crisis, constraint, and systems that weren't built to hold everyone. This is a conversation about courage, equity, and leadership, and what becomes possible when we name what we need and lead from it. You're listening to the Courageous Public Health Podcast, episode 45. To all the courageous women leading in public health, this podcast is your space to turn up the volume on your courage. This space centers your voice. This space celebrates your passion. This space amplifies your courage. My role? To listen, to amplify, and to stand with you in the fight for equity. My name is Dr. Christy McClamrock. I am an epidemiologist, consultant, the founder and CEO of Courageous Public Health, and the host of the Courageous Public Health Podcast. Each week, I have real, unfiltered conversations with women in public health about the challenges you face, the power you hold, and your vision for the future. We talk about the authenticity, vulnerability, and courage that you bring, not just to public health, but to every part of your lives. Because courage is about action, even in fear. It's about taking up space, leading unapologetically, refusing to be erased, and knowing you never have to do it alone. If you're ready to turn up the volume on your courage, if you're ready to take up space, if you're ready to smash the racist, patriarchal, cisnormative, heteronormative, ableist, capitalistic systems, then listen to this new episode. I'm Dr. Christy McClamrock. I started this podcast because courage is already everywhere in public health. It's just rarely named, supported, or treated as a leadership skill. Women are making high-stakes decisions inside complex systems every day, often without the infrastructure they need to do that work sustainably or visibly. Through Courageous Public Health, I work with organizations to strengthen leadership capacity by helping women move from pressure-driven or fear-based decisions toward action that's grounded in values, clarity, and integrity, even when the system itself hasn't caught up. I'm going to start today by sharing a bit about our guest, and then we'll jump into the interview. Angela Bannerman Ankoma is a strategic leader, equity champion, and community builder whose career spans public health, philanthropy, and social impact. She most recently served as Vice President and Executive Director of the Equity Leadership Initiative at the Rhode Island Foundation, where she led a statewide effort to strengthen a cross-sector pipeline of leaders of color. Under her leadership, the foundation invested $8.5 million in ELI and related initiatives, including a 3-year capacity building program for Black and Brown-led nonprofits. Angela is the founder and principal of the Bannerman Group, a strategy and equity-focused consulting practice that partners with nonprofit organizations, philanthropic institutions, and community leaders to advance inclusive leadership, strengthen governance, and design impact-driven strategies aligned with measurable community impact. She previously held senior leadership roles at the United Way of Rhode Island, guiding community investment during the COVID-19 pandemic, and at the Rhode Island Department of Health, where she co-directed the Health Equity Institute. Angela holds master's degrees in social work and public health from Columbia University and is working towards completing an executive doctoral program in health leadership at the UNC Gilling School of Global Public Health. She serves on multiple boards and advisory committees and is a recipient of the Robert Wood Johnson Foundation Award for Health Equity. She's a proud mother of 4 and co-owner of a family retail business. Are you ready to be inspired by some impactful courage? Let's go. Hi, everybody. So excited to be here and to introduce Angie Bannerman Ankoma today. How are you?
I'm well, thank you. Yourself?
Yeah. It's good. It's good. It's Monday morning. So, getting into it.
Yes. And it's a new year.
And it's a new year. Yes, it is a new year. So let's start by having you introduce yourself.
Sure. My name is Angie Bannerman Ankoma. I identify as she, her. I'm a mother of 4 amazing children. I am a first generation African born, the daughter of African born immigrants. I am a public health practitioner, also a social worker. I'm a community advocate. I love to support all things women, social justice, equity, and historically marginalized communities. Most of my work, both personally, professionally, intersects at any one of those touch points where I feel like I can contribute and make a difference and impact.
Yes. Beautiful. Snaps for that. Well, and it's funny because we were trying to figure out how we first connected, right? And it was on LinkedIn. I saw your stuff and your posts and all of those things that you care about. And I was like, yes, please. come on the podcast. So I'm glad that we were able to make this work. Okay. So let's jump into the first question. So I always like to remind everyone about the difference between courage and bravery. So bravery is taking action without fear, while courage is taking action despite fear. So I'm interested in some of your experiences, both in your professional life and in your personal life, where you've acted courageously.
Thank you for that definition because I actually had a conversation with a girlfriend of mine, another fellow public health practitioner, about some of the work that I was working on. And during the conversation, she said something which struck me. And she said she admired what I was doing. And she said, and I said, I don't know what it is to admire. I'm scared crapless about what I'm doing. Like I have no idea what I'm doing, but I'm moving forward, but I'm doing it. And she's like, that's what you should be doing. If you're not scared, your dreams are not big enough. And so opening with that is really, strikes a chord with me of the conversations that I've had more recently, and also with, people who I've known for a long period of time about, what does it mean to act in the presence of fear? Over the past couple of years, we collectively and me personally have seen that as well too. I would say, you don't always know that you're doing the work while shaking in your boots.
Yes.
And so something that comes to mind personally and professionally, was, really timely in the midst of the pandemic. And during the time I was working at a nonprofit organization in Rhode Island, overseeing the community impact team. And in that team, we served the public. And most of our work we did was in partnership with state and nonprofit leaders. I'll back up for a second because I was working in a nonprofit organization, not focused on public health, but as always with public health practitioners, we always come with everything with a public health lens.
Of course.
And so I had a conversation with a colleague. I have to look back at the time. She came up to me at like a coffee machine or maybe the copy. And she said, "Oh, Angie, I know you have a background in public health. There's this illness that we've been hearing in China. And, me and my husband, we have our anniversary cruise coming up in June. So he was wondering, should something be concerned about?" Like, oh, I'm forgetting. I won't say her name. Like, oh, Barbara. That's in China. You don't need to be worried about that in China. And so I shrugged it off. I said, "Oh my goodness, you're going to be able to go on your amazing anniversary cruise. You don't have to worry about it. I worked at the State Department of Health for 10 years. I know that my colleagues fiercely have started an incident command center. We prep for things like this. We're good.
We're on it.
We are on it, and we got this. Okay. And you don't have to worry about what's happening in China."
Yeah.
Fast forward 3 weeks later.
Yeah.
And I get that call from our then director of health in Rhode Island, because at the time, Rhode Island had its first positive case. And it was from a group of students and teachers that had gone to Italy for vacation and returned back. And, we started seeing positive cases as a result of that. So immediately I think about that conversation I had with my colleague, Barbara, who I said, don't worry about it. I'm like, oh no, Barbara, we need to, we need to worry about it now, right? It's right here. Rhode Island. I laugh now, but I was terrified, right?
Yeah.
In public health, we prepare for things such as this. We talk about things such as this. We've read history about things such as this. And I don't think anyone, maybe epidemiologists, believed that it would happen in our lifetime, right? And here it was facing us right head on.
Yeah.
And, I really appreciated having my experience in the Department of Health and knowing, I'd been at the Department of Health during H1N1 and similar viruses or similar outbreaks. And, we prepped, we tested, we did all these scenarios in order to be prepared for it. So I knew without a doubt that my public health colleagues in the state of Rhode Island were doing the best that they could, and they were working. I knew our leadership at the national level was actually doing the best that they can and working as well too. And I felt honored in the face of all the fear and panic to be able to serve in the nonprofit organizations, to be able to kind of provide the public health lens to some of the work. As you remember, there was a lot of evolving knowledge, there was a lot of fear, there was a lot of getting information out there. And so while, there was a lot of fear on the unknown collectively, I felt honored to be in a space where I could work with a team that was responding to the needs of Rhode Islanders at that time. And so that meant one of the things I managed during that time was a 24-hour call center. And so oftentimes the governor would say, if you have questions, call 211, which is our information referral network. And that immediately went, the calls would come into our call center, and we respond to everything from like accessing foods, helping people transition after they've lost their jobs as a result of the pandemic, helping people with housing insecurity, you name it, we did it during that time. And part of my role as a leader was also helping to not comfort, but also be transparent with the team members that I was working with as well too, right? And so there was a lot of fear within myself, amongst team members, what we could, what we couldn't do. Can we have access to masks? Where are we going to get access to? Like, it was just everything and all at once. And so one of the things that I felt really proud of was being calm, right? Being honest and transparent, and also developing trusting relationships with the team members and members within the community. And the organization that I work for was really trusted to be able to respond to the pandemic and lead in this fashion as well too. And so while I will honestly admit that I had a little bit of FOMO that I wasn't working actively at the Department of Health during this time. It's like we prepare for moments like this. I also felt honored that I could also do this work outside of a state public health or federal public health setting, and to be able to carry some of that information and knowledge and respond to needs of our state. We're a state of a little bit over 1 million people. And, there was fear amongst, you name it, nonprofit organization, schools, businesses, you name it. And so I would think that that is the most recent courageous time where I can think of. That's personally. Professionally, I was home in the middle of when my work was like doubling and tripling, but also caring for 4 kids at home who weren't. So I had a high school freshman at the time. I had 2 students in middle school, and I had a son in elementary, and we're all homeschooling. So nothing says, testing your limits, testing fears, and, homeschooling, which, when they say, some people act out what they want to be when they grow up, I always wanted to be a doctor. I never wanted to be a teacher because I knew I didn't have the skills. So here I was thrust into becoming a homeschool teacher in partnership with educators who, again, they were fearful. Our kids, this has been nothing they've experienced as well too. And so it took a lot of courage for me as a parent to be able to, lead within the home, manage the work. Again, that was doubling and tripling, as the days and messages and the needs needed, but also being able to support my kids as they, continue the academic support.
Yeah.
But even more importantly, social and emotionally. It was a
Yes.
really tough time. And I think, and I look back and say that, that was a time that sometimes we don't, again, less than what, 5 or 6 years ago, right? 5 years ago.
Yeah.
I don't think that we recognize how tough that time was for us.
Absolutely. Absolutely. I mean, we're in survival mode,
Big
right?
time survival mode.
Yeah,
So I think it required a lot of us to have courage,
for sure.
to work in the absence of fear, and sometimes with the absence of, knowledge or information, the best kept evidence. But, nothing made me proud than to see our public health community profession stand up, right? It
Yeah.
was a time for people to know what we do in public health. So,
Yeah.
what do y'all do, right? This is it. This is what we are. And so it's great to see, you know, that national global crisis. And then
Yeah.
people really recognize the importance of public health, what we do to draw people to the profession, right?
Yeah.
And to really give our profession the recognition and the accolades it deserves. Because as we always often say, you don't often see the work of public health because when it works, right?
Right. When it
When it works,
works, it's
it happens,
silent.
right?
Yeah, it's behind the scenes. Absolutely. Well, I love that you're focusing on some of the good things that came out of
Mhm.
the COVID pandemic, because I think it is really easy to focus on all the things that were difficult and not working the way that we wanted them to or needed them to, and all the limitations. And those things are still true. Like that, those things are still there.
Absolutely.
And
Absolutely.
you're right. It was like opportunities for courage left and right.
Hmm. Hmm.
You know,
Among everyday people too.
among for everybody.
Everyday people
Yeah,
who wanted to step up in ways in which they didn't even see themselves doing that. And similarly, like you said, I think that there's opportunity for us to learn from that as well too, right? Huge opportunities for us to
absolutely.
from that. And so I'm excited. I'm excited about the future in public health, despite the big gray cloud that we
Yes, yes. We have to stay positive about the future of public health.
it matters.
Otherwise,
Public health matters.
it does. It does. It does. And you know what? Like things are constantly changing in our world and in our lives. And, I don't know exactly where it's going to go from here, but it's not going to stay the same.
Not going to say the same.
It's not going to stay the same. Yeah. Well, thank you for those. Thank you for those examples. I mean, those are powerful examples.
Thank you.
Um, so I wanted to ask you, I also wanted to ask you, about sort of another side of courage, which is about being authentic and claiming and expressing your power, and particularly in spaces where it's not always welcome. And, unfortunately, there are a lot of spaces where it's not always welcome. Um, uh, for women of color, like it's just, yeah. So talk to me a little bit about how you express and embody your courage.
Thinking about that a little bit more, I would say how I embody courage, express power, is being unapologetic the things that are important to me. I am unapologetic with ensuring that all members of our society, particularly those who've been historically marginalized, have equal access to live a healthy life. And so,
Yes.
whatever space that I am in, I will always speak up for that. I will always double down on it. And I will always encourage people who are sitting at the table with me to lift that up. I think we've gone far too long in our country and our nation's history of having the motto or the philosophy of the rising tide lifts all boats. We know that is not true. We also know that there have been communities that have been historically targeted, disenfranchised, systematically excluded. And in
Yeah.
order for us to rectify that, we need to be very intentional, be very, very explicit about the ways in which we are going to address those needs. And it's not going to be a quick fix because we didn't get here one day. And
No.
so one of the ways in which I express my power is in making sure that at every table I sit at, that we talk about it. I'm unapologetic about things such as addressing infant mortality among Black women. I'm
Yes.
unapologetic about addressing increasing high school graduation rates among historically marginalized groups, because we know that increasing high school graduation rates, it directly impacts health outcomes.
Yeah.
I'm unapologetic about ensuring that people have economic access, because we know economic insecurity, housing insecurity impacts health outcomes. And so, I will always bring the social environmental determinants of health to a table where people don't even expect it.
Yeah.
I remember going into a school where we were working with them on a partnership of a youth program that was established during my time at the Department of Health, called Princess of Kings. Princess of Kings, called P2K for short, was a program to increase high school graduation rates among Black, Latino, Southeast Asian males, because we saw both locally and nationally how the decrease in high school graduation rates impacted pretty much the career trajectory. And
Yeah.
so, we had been awarded $1 million grant in the state of Rhode Island by the Federal Office of Minority Health to increase high school graduation rates. And I was talking to a school principal that we wanted to partner with, and I was sitting there with the community partners. And the principal, after everybody introduced themselves, and I mentioned that I was with the State Department of Health, he was like, "Oh, I'm surprised to see public health at the table." Or it was something of that nature. I'm surprised to see public health.
Yeah.
I wasn't expecting public health to be here. And I'm like, well, here's ways in which education impacts health outcomes, housing
Yeah.
impacts health outcomes, economic insecurity impacts health outcomes. And so the ways in which I can bring that public health lens to places and embody that power, and also looking at historically marginalized groups, whether it be rural groups, urban groups, and communities, I think that is critically important. And I don't want us to miss the message, miss the opportunity to be able to always think about those have been historically left out when we're thinking about programs, initiatives, funding, resources. Um, if we want to have a country that includes opportunity for everyone to succeed, we have to be intentional about that.
What a great opportunity, for that person to say, "Oh, I didn't expect public health to be at the table." What a great opportunity to be like, "Yeah, and let me tell you why. Let me tell you why let me tell you why I'm at the table."
Yeah.
And public health, we get to continue to be at the table, sometimes tables where we're not expected. I think that's really, really important, and taking kind of as you said, a broader view of public health than people in sort of out in the world take, right? They think public health. And at least now there's an understanding, like in the context of COVID, for example, but it's like, yes, so people know what public health is more now, but like we get to keep expanding their
Mm,
understanding, because public health is even more than what people understand yet.
absolutely. Absolutely. And so, that's probably one of my favorite pastimes to do, is to, find my spot on the table and be like, "So, hey, what are y'all doing here? And here's how public health is related to this. And here's what,
Yes.
you should be thinking about this," or utilizing our public health frameworks like evaluation and epidemiology, like the work and skills and the training that we receive in public health practice. They can be utilized in almost every setting.
I know. It's so true. It's like, you know, give me a table where public health doesn't belong. Like, and I would be very surprised, because uh, it touches like every part of our lives. Yeah. Beautiful. So, I want to hear about your vision, Angie. Like, I'm so curious about what your vision is, both your vision for public health, um, your vision in terms of these four areas that are so important to you. And I mean, I love that you're like, I'm unapologetic, because when I asked you to introduce yourself, like, you started there. You started with like, these are the things that I really care about. So yes, your vision for the future, and also then of course your vision for your own future.
So I'll start with my vision for public health as a public health community.
Okay.
My vision, as you mentioned earlier, public health is going to change.
Yep.
We're going to redefine ourselves or refine what we do. And I am hopeful that One, that we will emerge as a community that advocates for itself, that stands up. Now is a time to kind of stand up and speak about the importance of public health, and the significance of public health. And I think one of the areas that there's an opportunity for growth in public health is how we communicate about, one, what we do, or the work that's needed, or just the impact the impact of public health.
Yeah.
And so coming out of COVID, and also, the current political climate that we're in, my hope and aspiration is that we get some public health leaders who are fearless and courageous and standing up for what's right and what's just. And despite the headwinds that we're faced with, continue to press forward and not back down from science,
Yes.
not back down from true public health work, and not back down from the importance and impact that we make globally.
Yes.
So that's my vision for public health as a community, public health practitioners.
Yeah.
So my vision for historically marginalized communities is that we have the self-determination where equity isn't a byproduct, but it's the foundation of the work that we're doing, right? We've gotten really close to it. I think it's a huge opportunity that we have, a vision to focus further upstream. I talked a little bit earlier about squeezing myself into places where public health isn't traditionally thought of. So let's continue to squeeze our places where people don't traditionally. Let's squeeze find a seat at the place where people are talking about economic development.
Yeah.
Let's make sure that we're sitting at the tables when they're talking about education at the highest levels of this country, right? Yeah. When we're talking about housing, there needs to be a public health practitioner at these tables. So we should definitely be there at each and every one of these tables, and be able to have real decision-making power as well too. My hope and vision is that public health has the resources to do what it needs to do. We've done a really good job, with, trying to make a dollar out of 15 cents.
So true. I love it.
Let's fund public health at a level that needs to. And I'm going to walk back on a vision that is really near and dear and personal to me. And I've talked about it more recently. A couple of weeks ago, as I mentioned, I'm in Rhode Island. A couple of weeks ago, it's been personally important to me to utilize a public health approach to gun violence. I've grown up, I live in a community that has been disproportionately impacted by gun violence. I live in a country that has gross amounts of gun violence, individual and, large scale gun violence. And for me, it literally pains me, like deeply pains me that it's something as a public health professional that is preventable, largely preventable. And a couple of weeks ago, we had the incident in Rhode Island where there was a mass shooting at Brown University, which is, Rhode Island is like this big. And so when something happens at Brown University, to all of us in the community. And Brown University is intertwined with our school, with our state, our city, Providence, and our state. And so after watching and witnessing mass shootings happen everywhere else, it had hit home. And so my hope and aspiration is that we begin to have the courage to be able to utilize the public health approach, have the resources that it needs to address gun violence prevention as a country. And so that's something that has been it's always top of mind to me, and it pops up every single time we have one of these incidents. And again, as a public health practitioner, every preventable death, it really pains me, right?
Yeah.
Because there's certain things like cancer is one of those things that we're working on, heart disease, something is hereditary, but like gun violence is one of those things like, we know in public health, we've done this with seatbelt prevention. We've done this with a number of other smoking, we know what to do when given the resources and be able to do that. And so gun violence is another area that nationally and that I think that we need to grab it by its horns and not let go. We get beat down every time, on that.
But I feel you like that's an issue that's also really important to me. And it's like, I feel that one in my body. Like I feel that in my body. Yeah. It's
hard for me even to talk about it without being emotional because it's like what's it going to take for kids? Like I have young kids myself, and
Yes.
I have college students, and like, come on, people shouldn't
Yeah.
have to live this way,
Yeah.
right? People
Yep.
should have to live this way. People should be able to go to the store. People should go to movies. People should be able to sit in the classroom. People should be able to sit in the kindergarten classroom.
Yeah.
People should go to work
Yeah.
without having to think about these things happening. And now we're seeing it happen where people who have been impacted twice.
That's incredible. I mean,
I don't have the words for that.
yeah,
So,
all the hairs just stood up on my arms. Yeah.
it's like rage. I'm like, I can't believe we're doing this again. Like, really?
Yeah. Yeah.
So something we could do something about, but we haven't. We need to.
Yeah. Yep.
I want to see more Black women in public health leadership.
Yes.
Right?
Yes.
You may have seen a lot of the work where, I don't think it's by accident that there's a large workforce that has pushed Black women out of the workforce, right?
Yep.
That's particularly pronounced in government.
Yeah.
Right. And one thing about Black women when they lead, one of the things we do when we do lead, it's never for self. It's always for the community. And I think that our country would be better off if we had more Black women in leadership positions, whether it be public health institutions, or it be nonprofit institutions, it be government institutions, or it be in elected positions. I think we need more Black women leading and charging the way. Because when we do lead with conviction, with values, and it's not self-serving. It's always serving on behalf of a larger community.
I support that 100%.
That's my last personal vision of, we need more Black women in leadership positions. We've taken a really tough hit in the past year and a half or so. And so I think that it's important to remember when we're thinking about ways in which we want to rebuild and recover, that we think about Black women and make sure that Black women are at the table and also leading.
Yes.
What this looks like moving forward.
Yep. Tell me what your vision is for your future.
I have an entrepreneurial spirit.
Yeah.
And so my vision is to be courageous and kind of lean into the entrepreneurial work. And, I've launched an independent consulting business as well, too.
Yeah.
And to be able to grow that. I've often served behind and near and around other leaders. I think it's time for me to be up front. I think that's my vision for myself is to be able to lean into the years of experience I've had, whether it be personal lived experience, whether it be experience as a leader in government, public health, mental health space. I always joke and say, like, I've had like a bazillion jobs. You name it, I've had a job. Like, I even delivered telephone books for Verizon when we used to have I worked at Burger King. Like, I've had, like, it's been like when people like, you have customer service, and you're just like, I do. I worked at
That is great lived experience.
Yes, it is.
Absolutely.
So whether it be helping nonprofits, helping and supporting leaders, helping strategy and visioning. I really love helping people lead and groups lead and fighting that good fight.
You get to be the Black woman leader that you want to see in the world.
Absolutely. And support other women leaders as well, too.
Absolutely.
Right?
Yes.
Because yes, I'm intentional about making sure that we support Black women, but I'm, like as I mentioned earlier, all historically marginalized groups.
Of course.
In ways in which we can uplift and support them. And so, some days, like, I'm not sure if you heard the term that Issa Rae said. They asked her a question on a red carpet, and she was like, "I'm supporting everybody Black. I'm doing that, and I'm supporting other good and amazing causes as well too."
Yeah. Oh gosh, I love Issa Rae.
Yes.
Yeah. Well, thank you so much. This has been a great conversation, and I really appreciate having the chance to connect with you and talk to you. I want to make sure that our listeners know how they can connect with you as well. So, what's the best way to do that?
Professionally, I think the best way is LinkedIn.
Yeah.
It's the best way to reach out to me, and
Okay.
I'm a frequent responder of inbox chat. So I try to be responsive.
Yeah.
And so LinkedIn is the best so far, yeah.
again, like you responded to me. So that's great.
Was it 3-4 years ago now this year?
It took us 4 years to like actually do this. Yes, that's true. But yes.
I believe the time is always right when it happens.
Right. Totally. Absolutely. So, I will make sure that your LinkedIn link, that always sounds funny to say, your LinkedIn link is in our show notes so people can connect with you that way and learn more about your courage. Thank you so much. And we'll be in touch. I'm excited to stay in touch.
Thank you for your graciousness, Christy, and taking the opportunity for us to chat today. It was a great time.
Thank you. Sometimes courage is managing a 24-hour call center during a pandemic while homeschooling 4 kids. Sometimes courage is explaining, again, why education, housing, and economic insecurity are public health issues. Sometimes courage is being unapologetic about Black women leading and about equity being the foundation, not the afterthought. Angela Bannerman Ankoma challenges us to squeeze ourselves into rooms where public health isn't expected and then make it clear why we belong there. She reminds us that preventable harm should pain us and that knowing what to do means we have a responsibility to act. If this conversation made you think about the women on your team, in your organization, or your own leadership, this is exactly the work we do through Courageous Public Health. We partner with organizations to offer facilitated, interactive virtual workshops for women leaders in public health, turning courage into a leadership skill so it becomes an organizational strength. Because when we're unable to act on what we already know is preventable, communities continue to bear the harm. Interested? Reach out. Links to connect with us are in the show notes. Until our next episode, stay courageous. Thank you for listening to the Courageous Public Health Podcast. Visit courageouspublichealth.com to find the show notes for each episode and learn how to connect with us.